Good morning, YouTube family and friends. Hope you all had a great week. I had an awesome week on my birthday cruise. I just got back into town yesterday, so that's why this video is a day late. So yesterday was a travel day for me. So yeah, I had a 7-day cruise out of Galveston, Texas on the Carnival Jubilee. And yeah, it was awesome. I love cruising. I really do. So if you want to see any of those videos, go ahead and go over to my other channel, Cruise with Sean, and you'll be able to catch those videos. So, but anyway, this is my week 73. Yeah, week 73 of being back on Mounjaro while dealing with a host of medical issues, including generalized myasthenia gravis and autoimmune disease. And I'm going to talk a little bit more about that today because even though I had a thymectomy back on June 9th, which was a little over 2 months ago, I'm getting flare up of symptoms with it. So that's what we're going to talk about today. Uh, Today is August 17th, 2025. So, okay, about 3 weeks ago, periodically I would get tongue weakness where I can't move my tongue all the way to the back, like right now. When I eat, you know how sometimes you get food stuck in between your teeth and your cheek, so you move your tongue all the way back to the back part of your teeth and up and around and over to clear out all that food that's in between your cheek and your teeth. Well, I'm losing that sideways movement when I eat. It was just happening periodically, but now it's happening for about a last little over a week. It's happening every time I eat, and it's even happening if I talk too long, like I'm on the phone talking to my mom. It's happening where I feel like my tongue's getting weak. I start to kind of like it's hard to pronunciate words. It's kind of almost like I'm slurring words a little bit. Even now, I'm starting to feel a little weakness in my tongue. And then also, I'm having trouble swallowing my food, especially if it's a drier food. I'm having to swallow 2, 3, 4 times because when I ever swallow some food, it feels like it's just a lump in the back of my throat. Just it's not going down all the way, or maybe part of it's not going down. So I have to sit there and just kind of like swallow it again, swallow it again. Sometimes I have to take a drink of water or whatever I'm drinking. Usually it's water. Drink it to help it go down. So I said it's happening every time I eat. Now, if I just do that sweeping movement, if I do that a few times, I'm not able to do it again, and I have to wait and relax the tongue, just let it be, and then I can do it again. But if I do it too soon, I can do it once and then I can't do it a second time. So good thing is I already have an appointment with a neurologist for a follow-up this Monday the 18th in the morning. So I'm going to bring that to him. So this is just disheartening. I had that thymectomy. I had that surgery to remove the thymus gland. I know the doctors said, the thoracic surgeon said, no, it takes 6 months to a year at least before you can see any improvements to your symptoms, if that was the cause of the autoimmune disease. There's no guarantee the thymus gland was the cause, but it was enlarged. There's no cancer in it, but it was enlarged. So I was really hoping that it was the reason for the disease, and by having it taken out, then that would resolve my symptoms. So I knew my symptoms would go away, but I didn't think my symptoms would progress. Getting weak. So yeah, it's 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 disheartening to know that my disease is progressing now. It's the tongue and the swallowing is part. I think it's called bubar. Bubar. You know, the droopiness of the eyelids and the eyes going wacky. That's ptosis. At least the drooping of the eyelid is called ptosis. Ptosis, I believe. And there's something else for the eye double vision stuff, but affecting the tongue, speaking, swallowing. That's bubar. Bubar, I think, part of the myasthenia gravis. So yeah, this sucks. I'm still not back at work yet. So I've already used up my 12 weeks of FMLA slash short term disability. So I'm still on it. I'm still getting paid, but my job is no longer guaranteed. So I don't know how long they're able to hold my job for me. I don't know when I'll go back to work, if I'll be able to go back to work. I'm still not in the right headspace. I have a follow up with the psychiatrist uh, on the 29th, I believe. Yeah, sometime next week. I got like 3 different doctor's appointments next the last week of August. This coming week, tomorrow I have a appointment with the neurologist and nothing else for the rest of the week. But that that psychiatrist is still at the immediate care facility. I still need to try to get a regular therapist and a psychiatrist. So I need a Monday after my appointment. I need to call a couple of places. The one place never called me back. I called left a message and they never called me back. So I'm gonna try them again and also try this other place so I can try to set up a regular therapist and psychiatrist because I can't continue to use the immediate care. No, I have a follow up with them on it with that psychiatrist that prescribed meds. But yeah, those meds. I didn't take the one I'm supposed to take at night to help me sleep because during my cruise because I want to be awake for it. But the other medication I'm still taking in the morning that the psychiatrist prescribed. But that gives me tremors. So, but I'm just dealing with it. They're not horrible, but it's just an awkward feeling. So, but anyway, so that's my update for you. My weight. Now I was getting worried. I was losing weight, and all I do is lay around. But good way to stop weight loss is to go on a cruise. So the day before the morning I flew out, I weighed in at 238. Well, I weighed myself this morning, which is like a week and 3 days, and I weighed in at 241. So I gained 3 pounds during my cruise. So yeah, I understand because I ate a lot more. Even though it's hard for me to eat, I was eating a lot more. So a lot of ice cream cones. My tongue even gets weak eating ice cream cones. Maybe because I'm licking the ice cream, doing a lot of tongue movement. So, but anyway, so that's the update. That puts me at a +5, 5 pound weight gain for the 73 weeks of being back on Mounjaro while dealing with medical issues. So, but I got my Mounjaro shot here today, 7.5. Remove the protective cap. You'll see it in there. You can see a little drip of medicine already on it. Move it to the unlocked position. You can do the fatty part of your arm, your gut, or your thigh. I always do my belly. So I'm still bruised from the last shot. So we're gonna do over here. This gotta be at least 2 inches away from your belly button. I just showered, so I'm nice and clean. So you just pick a spot at least 2 inches away from your belly button. Here we go. It's that simple. No blood that time. Yay. So there's my shot for the week. All right. Hope you all have a great rest of the week. And I'll keep you updated on what the neurologist says on Monday. So if you like this video, go ahead to the like button. And if you're not already subscribed, go ahead and subscribe. And then just be kind to everybody. Treat everybody with respect no matter what. So, all right. Love you all. Bye-bye.